Let's speak to our friend GP Dr. Helen Wall. Hi, Helen. Morning. Should we go through these areas of change separately? Let's start with this move to digital. So in a GP surgery like yours, kind of what might that mean and how will we experience things differently?
I think we've already been doing this over the last 5 years, certainly in the pandemic when we weren't seeing as many people face-to-face. We expedited our digital resources very, very quickly. So we see a lot more now online consultations, online triage, where people have to put an online form in order to get an appointment, text messaging, video consultation. So we've seen that happening. I think those things are great and they do work for a lot of patients, but for me it's about, there's nothing in healthcare where one size fits all. We've got to make sure that we're not leaving people behind. We do have instances where older people who don't have access to digital technology are being left behind, and we need to make sure in this plan that doesn't happen and that we include everyone.
And
that's
could
really
be the people
important.
Who need care more than others.
Yeah, it's really, really important for me, that.
And does that also feed into this idea that community services desperately need building up?
Absolutely, we need to do that. And again, I keep going back to the pandemic, but we learned so much in that time. We saw that if we put services into communities, then we increased our uptake of vaccination. But since then, we've also done that with things like cervical smears, taking all sorts of blood pressure monitoring, everything. If we take that into community, if we put it in things like shopping centres and markets and places where people already are, where there's a footfall, we know that we get greater uptake. So we need to make that more accessible and make healthcare more accessible for individuals.
That kind of testing in the community, that leads us on to this third area where they're talking about prevention. Not just reacting when somebody gets ill, but trying to stop them becoming ill in the first place. How feasible is that when you're a busy surgery and you're already having to firefight?
Yeah, this is a huge thing, and that's exactly what we're doing, John. We're firefighting. And, in the time that I've been a GP, which has been around about 15 years now, I've seen a huge shift in how we work. And what we do now is a lot of on-the-day, same-day emergency care. And that's not what we were ever trained for. We were trained to do that continuity of care, that chronic disease management, health prevention, health promotion, and we've had to shift. And I think I was reading a statistic, over 50% of appointments now are same day for general practice, which never used to be the case. And I know a lot of people will say, well, A&Es are really busy because people can't get a GP appointment. But equally, we're seeing people who don't want to go to A&E and are coming to us thinking they're having a heart attack or something. They should be going to A&E. So I'm not saying everybody's working really hard and the system's really, really busy all over, but it's about getting people to the right place at the right time. Is
that really, so you say 50% of people you see are on-the-day appointments, people who phoned up that day?
Yeah.
Really? Because that's not the case everywhere. I'm sure a lot of people say, I've been waiting weeks for an appointment and can't get to see it.
But it's that sort of, is it an emergency today? Well, people will, again, get left behind in that because some people don't want to say it's an emergency, some people will say it. I mean, what is an emergency? We shouldn't be having emergencies in general practice. We're not an emergency service. It's a misnomer, really. So we need to get back to make sure that people get seen in the right place at the right time in a timely fashion.
It's part of the problem, again, as a result of the pandemic, that lots of people don't want to bother their doctor, so leave things too late.
We're always going to see that, and we saw that before the pandemic. We certainly saw it just after the pandemic. I think that's changed again slightly since then. I mean, we're 5 years on now, and I think people are getting back to wanting that access to healthcare. But there's a big sort of Amazon Prime culture as well, isn't there? People want things and they want things today or tomorrow. So we've got to sort of rejig the whole system and make sure that we can give people what they need and do it in a timely fashion and make sure they're getting the right care. And we can then go back to preventing and promoting health as well as firefighting. OK, Helen, always good to chat. Thank you for your insights. And you can watch that BBC Panorama episode about the government's plans. It's called Fixing the NHS. What